Great. So welcome, everyone. Welcome to Chicago Beyond for this exciting day. I'm Liz Dozier, and I am the founder and the CEO of Chicago Beyond. It is an absolute honor and a pleasure to welcome Governor Pritzker, Lieutenant Governor Stratton, and all of our distinguished guests into our space today for this important moment for women and families here in Illinois. Chicago Beyond, as some of you may know, has a vested interest in birth justice. We are a national philanthropic organization that addresses systemic inequity by truly backing solutions led by those who are closest to the issues. Since our inception in 2016, with the generous support of Mark and Kimbra Walter, we have dedicated over $65 million to individuals and to organizations who are truly in the fight closest to these issues. So one of our incredible leaders that we have had the pleasure and the honor of partnering with is Janine Valerie Logan. And we invested in Janine to give her space, to give her time, and to give resources to actualize her dream of opening Chicago's Southside Birth Center. And the center, as many of you know, will provide vital options to more women and to more families in our city. My team and I are focused on birth justice, not just here in Chicago, but ultimately nationwide, because it is unacceptable that Black women are 3 times more likely to die from a pregnancy-related complication than white women. Governor Pritzker, your partnership in these efforts continues to be invaluable. You are an integral part of this journey, and in many ways, today is truly a full circle moment. Last year, we actually shared a stage with the governor at the Clinton Global Initiative. And Governor, it was then that you championed women's reproductive rights and shared your vision for Illinois. And at that same event, Chicago Beyond committed to the Fellowship for Black Maternal Health, which was modeled after our investment in Janine. And our partnership grew from there. Earlier this year, our governor uplifted Janine and her work at the State of the State address, unveiling the very bill that he will sign today. In February, we all met at the Chicago Southside Birth Center to underscore the importance of this bill. And Lieutenant Governor, our team recently shared a stage with you to share our work with other national funders. And now, here we all are here today in this full circle moment of this bill signing. So special thank you again to Governor Pritzker, and thank you to Lieutenant Governor for advocating on behalf of women and on behalf of families in our state. Thank you for using your platforms to amplify community-based birth leaders who have proven solutions for impacting and improving Black maternal health. Again, I'm thrilled that this moment is happening, this historic moment for Illinois is happening in the space of Chicago Beyond, and that this space truly was designed to uplift, to elevate voices that are often unheard, to fight for our collective work for equity. So thank you. And with that, I'd like to welcome to the stage, it's my great honor and privilege to welcome to the stage Lieutenant Governor Stratton.
Good morning, everyone. Good morning. I am Lieutenant Governor Juliana Stratton, she, her pronouns. First of all, thank you to my friend, Liz Dozier, for your kind words and your leadership, and thank you to Chicago Beyond for hosting us. Do you all feel that? It's the page turning on a new chapter in maternal health care. Before I dive in, I want to pause and shine this spotlight on the community leaders who set the Birth Equity Initiative into motion. In 2022, Janine Valerie Logan and a group of Black midwives and doulas, some of whom are in this room, joined my office for a monthly community engagement that we call Tea with the LG. It was good. We actually had tea. But they brought with them candor, concern for their people, optimism, and meaningful ideas for change. And it is because of them that our conversation transcended into legislative action, reminding us all that those closest to the problem are also closest to the solution. I want to wholeheartedly thank Leader Robin Gable and Senator Lakeisha Collins for guiding this bill through this session with powerful conviction and urgency. To our partners in the General Assembly, including Representatives Morris, Mueller, and Blair Sherlock, and Canty, and Senators Preston and Johnson, and all the advocates who are joining us this morning, thank you for your willingness to hear what Illinoisans need and join in delivering results. And finally, to the man wielding that long-awaited pen, Governor Pritzker. In the last few months, I've emphasized your ability to thread compassion and responsibility throughout your leadership. And today, I am overwhelmed at what that delicate balance has accomplished. That said, I have to acknowledge how darkly ironic it is that we celebrate Illinois' work to empower women as our neighbors to the west woke up this morning with even fewer rights than they had last night. Iowa is now the 22nd state in the nation to enact an extreme abortion ban, solidifying that 1 in 3 women of reproductive age in America now live without access to comprehensive reproductive care. The Birth Equity Initiative is Illinois' way of strengthening protection for the full spectrum of reproductive care. It bolsters our administration's belief that no government should decide when or if a family grows, and ensures that when families do expand, both mom and baby have access to the care they need to get home safely. Yes. This initiative then goes a step further, acknowledging the substantial gap in care for mothers who do not fit the criteria of white and urban dwelling with unlimited access to resources. As eyes are glued on the Summer Olympics in Paris, I'm thinking of Olympic gold medalist Allison Felix, the most decorated track and field athlete in history, who, facing unexpected complications during the birth of her daughter, realized that no amount of money or status can compete with the pervasive racism in healthcare. If she, an Olympian in top shape, with a robust support system, was not spared from the risks that haunt black mothers, no one is immune. Speaking out on the issue, Allison said, "The more women who speak up, the more women will have a voice. Because when a woman speaks up and shares her truth, you really feel that collective power." Well, I'm proud to say that Illinois heard that collective power, and now it's our turn to deliver. We're bringing private insurers up to parity with Medicaid, demanding coverage for holistic birthing care and postpartum support. We're investing millions into assessing the crisis in mortality for Black women, and we are activating a pilot program to tackle the hidden health emergency facing 47% of American families: diaper needs. Every woman, regardless of race or zip code, deserves to bring life into this world safely and with dignity. And whether you're on the south side of Chicago or downstate in Cahokia Heights, no family should welcome a new soul with grief for the one who carried it. I'll end with a word to the families for whom this support comes too late. Your loved one lives on in you, in each of us, and in our shared home state. The Birth Equity Initiative is a promise that her life and death mattered, and for as long as this administration has breath, Illinois will honor her. Thank you. Today really is a great day in our state, and it couldn't have happened without the extraordinary leadership of our great governor, the best in the nation, by the way. Please welcome Governor J.B. Pritzker.
Well, good morning. Thank you all for joining us for this truly significant step forward for maternal health. I want to start by recognizing the truly tireless work of a true champion for women and families, and that's the best lieutenant governor in the nation, Juliana Stratton. Juliana put in countless hours of work to make this birth equity initiative a reality, listening to our communities in need, crafting language with experts and stakeholders, and negotiating to get it across the finish line. I am exceptionally proud and immensely grateful to have her as my partner in governance. Thank you, Juliana. This law never could have found the light of day but for the vital role of the Illinois House and Senate, especially the chief sponsors, Leader Robin Gable and Senator Lakeisha Collins. Yeah. The General Assembly has been our partner in progress for years, and I want to express my deep gratitude to them on this occasion, and also to their leaders, House Speaker Chris Welch and Senate President Don Harmon. Yeah. In Illinois, we have some of the most dedicated and caring community and healthcare advocates who made this their mission in the 2024 spring session. Liz Dozier, we just heard from our host, and of course, right here at Chicago Beyond, does work that almost no one else does, and we're so grateful for the work that she does to support organizations across the city and beyond. Sarah Garza-Resnick of Personal PAC, and Kelly Hubbard of EverThrive, Illinois, and so many others. I just want to say that, as you know, in the General Assembly, we have champions in the House and the Senate, in the governor's office, but often the reason there is excitement and movement on these issues is because people who are doing this work on the ground are making it happen. And so I want to just say to the advocates, thank you for everything that you do to advance this cause. From start to finish, the birth workers who are here with us, including Dr. Janine Valerie Logan, brought their experiences and passion to help shape this initiative from the very beginning, and they are on the front lines ensuring its success. We have work to do. There's no doubt. There is a lot of work ahead, but it is because of them that we will be able to deliver on the promise of this legislation. Finally, I am blessed to work every day with compassionate and visionary people in the office of the governor. Emily Miller came into my office one day last year, and she said, "Governor, we can't wait any longer to solve the problem of women being denied equitable access to health care when they're pregnant and being put in danger by the inequities of the healthcare system." Now, you know, when someone who works for you and that you care about comes in to tell you that, you need to act. So then she went to work with Juliana and proposed how we would do it, what it would cost, and who we would work with to get it done. And she was all in, and so was I. And that's why I want to say a special thank you to Emily Miller for her exceptional work in getting this across the finish line. Reproductive freedom and maternal health go hand in hand, and every time we make an advancement in the cause, I thank my mother for instilling in me the drive to protect those rights. For too long, we have failed to live up to the promise of equal health care for Black and brown mothers in this state. For example, as you well know, Black women are 3 times more likely than white women to die from medical complications during pregnancy and childbirth. That is appalling, and it's unacceptable, and we're not going to let that happen anymore in the state of Illinois. It isn't right that some women are forced to weigh their own mortality or their future health against bringing life into this world. All mothers must have the full spectrum of maternal health care available to them. With the enactment of this new law today, we bring ourselves closer to a state where every mother, no matter her race, economic status, or zip code, is afforded the right to a safe and healthy pregnancy. This initiative is part of the most robust birth equity effort in the entire nation. It is a package of reforms and investments that will assist pregnant women and families at every step in the process. It'll improve long-term health outcomes and make pregnancy-related care more culturally responsive. Again, there's more work to do, but this is an enormously important first and big step. Our Birth Equity Initiative creates funding opportunities for birth centers in underserved areas. It expands home visiting programs. It creates a pilot program, as you heard, providing free diapers for new mothers most in need. And it cuts red tape to help make doulas and midwives more accessible to more people. This is the kind of absolutely vital pregnancy care that makes a transformational difference to new and expecting mothers' health outcomes. Since day one of my administration, I have committed myself to the same goal, to make this the best state in the nation to raise a family. And I'm incredibly proud to be with all of you today as we take an enormous step closer to making that vision a reality for all families in Illinois. And with that, I want to hand this podium over to another tireless advocate for Illinois children and families, and someone without whom we could not have made this progress and in so many other areas moved the ball forward on protecting women and children in this state, Senator Lakeisha Collins.
Sorry, I have to bring the microphone down just a little bit. Good morning. Good morning. I'm State Senator Lakeisha Collins, and I represent the 5th Senate District, which we are sitting in right now, which is one of the best districts in the state of Illinois, I might add. I would like to thank Liz Dozier and Chicago Beyond for hosting us here today, and to my colleague and my friend and a leader in the House of Representatives, Robin Gable, for your instrumental role in advancing this vital piece of legislation. I also would like to extend my gratitude to the advocates, the doulas, the healthcare professionals who have shared their personal stories and expertise to ensure the success of this initiative. A huge thank you to Janine Valerie Logan and for her hard work and for standing on the front lines for Black women across the state of Illinois. And I would also like to thank a good friend of mine who I don't have enough words to say this, but she truly is a good friend of mine, and that's Sarah Resnick. Thank you for all of your support. I applaud our governor for his steadfast commitment to uplifting women overall and supporting equity in Black maternal health, and for standing with all women in the face of opposition. We have a governor who talks the talk and walks the walk, and I admire his fearless leadership and being unapologetic for putting women and families first. Furthermore, I would like to thank our beloved Lieutenant Governor Juliana Stratton for her fierce leadership and unwavering support. Throughout this process, she has stood on her commitment to getting this across the finish line, and I know how hard she worked to make this a reality, and even telling her own personal story, which I relate to so deeply. We have a Lieutenant Governor who will check on you and encourage you. She checks on you about your self-care. And through this process, I'm gonna be a little bit vulnerable here. It was hard for me. I'm new to the Senate, but this bill was definitely a challenge. Not a challenge like you think. It was a challenge because, one, I know that there are women who look like me and women all over this state who are faced with these barriers. And I knew how important it was to get it done. And it's a mental wear and tear sometimes when you're fighting for what's right. But to have my Lieutenant Governor call me and just say, hey, how are you? Are you okay? Did you take some self-care today? I want to know how you're doing. We're going to get it done, but take care of yourself. So I thank you for that, Lieutenant Governor. This collaboration within our administration is truly commendable, and I would also like to thank our administration's remarkable team for their tireless efforts to ensure we got this right and we got it done. Thank you, Emily. Thank you to all the staff. to all the LAs for all of your hard work. And I also want to give my appreciation to our House and Senate leadership and to my colleagues on both sides of the chamber for their support of this legislation, because it truly takes all of us in both chambers to make this a reality. I would also like to thank our staff in both chambers as well for the important work that they do. As a Black woman and a mother of 3 young Black boys, this legislation was personal to me. The increasing rates of infant and maternal mortality, particularly among Black women, it demanded urgency. African American women are 3 to 4 times as likely to die from pregnancy-related complications, and what's even more horrifying is that 80% of those cases are preventable. But by passing House Bill 5142 and witnessing our governor sign this historic piece of legislation into law today, I am proud of what we all accomplished here. We lost an alarming number of Black women who were simply trying to seek the health they needed and deserved, but unfortunately was too late in receiving proper care. But today, Democrats here in Illinois have changed that narrative. Together, we have broken yet another barrier, rewriting the wrongs of history and ensuring that this cycle of systemic racism and oppression ends, restoring confidence in Black maternal health so that women can feel seen, feel heard, feel safe, and feel comfortable that when they go to their healthcare professional with concerns, that they're not brushed off, but they're listened to, and that cost is no longer a barrier, and now they have options to birth their babies at homes or at a center, which is deeply rooted in our history. This legislation will provide life-saving health care for women and their babies, regardless of their income, background, or race. It will require that providers cover services such as midwives, doulas, postpartum care, certified lactation consultants, breast pumps, equipment, and so much more. And I've said this before, but from Chicago to rural Southern Illinois, women across every community, every zip code, they face unexpected complications during pregnancy. And without the coverage of insurance, are faced with life-threatening complications that are preventable. But no one, and I mean no one, should have to pick and choose their health, the health of their babies, for basic necessities. They should be able to do both. This law is not just about health care. It's about justice. It's about equality. It's about the right of every mother and child to have access to the safest and the most effective care. And ultimately, what we have done here in Illinois is we are reducing the mortality rates and ensuring a healthier future for all Illinois families. I'm grateful to have a governor and a lieutenant governor, along with my colleagues who get it, who continue to show up for our families across our state. And when we're attacked for simply trying to do what's right, we continue to push forward because we understand that lives are on the line, and like so many other important pieces of legislation, this will save lives and increase healthy outcomes. Thank you, Governor and Lieutenant Governor, and to my chief co-sponsor, Leader Gable, and all who stood on the front lines with us to make this a reality. And next, I would like to bring up my friend, one of my leaders when I was in the House, but she is truly a leader. She's been doing this work for a very long time, and she does it from the heart and from her experience and from her lived experience. And so I want to introduce to you Leader Robin Gable. Thank you.
Well, we've heard a lot already, haven't we? I was going to do my thank yous at the end, so I think I'll keep with that. But there are so many thank yous to give. I do want to just thank Governor Pritzker for this transformative policy for birth equity in Illinois. It was really my honor to sponsor this legislation in the House. As a lawmaker and former executive director of EverThrive, a policy and advocacy organization for maternal and child health, I have spent my career working on behalf of newborns and mothers. It is so heartening to me to see a governor who understands that a safe, healthy pregnancy shouldn't be predicated on one's income, background, or race. It is a fundamental right. With the signing of this legislation, we will now have laws that require insurance companies. Illinois has been the Wild West of insurance companies. They have pretty much done whatever they wanted. And in this administration, that is not going to be true any longer. They're going to be required, and Medicaid is going to pay for the most effective ways to improve maternal health and infant health: doulas, midwives, and lactation consultants. Having somebody walk that walk with you when you're pregnant and verify how you're feeling and helping you maneuver through the medical system has been shown to be the best use of our dollars. This is even more important in the context of a recent nationwide decline in maternal and child health. Maternal mortality has increased. It is shocking that the wealthiest nation that has ever existed in this world has this problem. It must and will be addressed. So along with the diaper pilot program, which you've heard about, a bill that I carried for a number of years unsuccessfully, so I'm glad that we finally have that done, and a child tax credit, which will actually put dollars into the pockets of working families with children. This legislation truly is transformative and will improve the lives of so many women and so many families. So I would like to thank everyone that's already been thanked, but I'll do it again. First, Governor Pritzker for his forward-thinking policies and his whole policy team led by Emily Miller. Thank you, Emily. I also want to thank advocates like Janine Valerie Logan, who has been working so hard on this issue. And in addition, some folks over at the University of Illinois who have been working on a maternal health project for a number of years and have really helped to inform our policy at the state level and the national level, Arden Handler and Stacy Geller. So I truly want to thank our Lieutenant Governor, who is amazing, just amazing, and such a support to all of us. She sat there in committee with me. I think you were on the floor when I did the bill as well. First of all, to share her story, which is so compelling, and second, just to be there to support all of us. It's so much appreciated, Lieutenant Governor. And I also want to thank my colleague, Senator Collins, who so deftly guided this legislation through the Senate and so proudly tells her own lived experience as well. Thank you, Senator Collins. So now, as we say after we pass these important bills, on to implementation, right? It is my pleasure to now introduce one of my newer colleagues in the House, Representative Yolanda Morris, who I am so excited to have in the House. She is such a bright light and full of energy, and she is truly a rising star. Come on, Yolanda.
Good morning, everyone. Good morning. I am Yolanda Morris, State Representative of Illinois' 9th District. I am a proud advocate for House Bill 5142, which addresses the needs of pregnant individuals, new mothers, and their newborns in Illinois. Having experienced health disparities in my own family, I am passionate about ensuring equitable access to maternal health care. Our communities, especially those of color, face significant health inadequacies leading to poor outcome for women. House Bill 5142 is a vital step in addressing these issues. It requires insurers to cover essential services for paternal doulas, licensed midwives, including home births and support during labor, abortions, or miscarriages. It also emphasized postpartum care by providing coverage for lactation consultations and necessary supplies for at least 1 year after birth without cost sharing. Let us unite to create a healthcare system that is inclusive and equitable for every woman and child in our state. Together, we can ensure that all families have access to care they deserve. Thank you all for your support in building a healthier and more equitable Illinois. Thank you.
And with that,
We have Valerie.
I'm sorry. Sorry. And I would like to introduce Janine. Sorry, I had a blur moment.
Y'all sweet. Good morning. There are so many things I want to say today, but I'll start off by saying thank you. Thank you, Governor Pritzker and Lieutenant Governor Stratton. Thank you, Senator Collins and Leader Gable, for carrying this bill. This is truly a historic day. My name is Janine Logan. She, her, goddess pronouns. I'm the founder and lead steward of Chicago Southside Birth Center and a leader in residence here at Chicago Beyond. I am leading the effort to establish the first Black midwife-led birth center on Chicago's South Side. And ultimately change how people choose and receive reproductive health care in their own community. Although we still have quite a ways to go before we open our doors, HB 5142 will give families greater access to midwives, to doulas, and mental health services and resources they need to change systems. Be it in government, philanthropy, community birth, a huge part of our work to change systems is to gather, share experiences, deep listening, and trusting of each other to make this change happen. The culmination of this work is exactly what we did and exactly what you're seeing today. Thank you to all of the community partners in this room, being strong advocates for your partners, your clients, your families. You all made this happen, so thank you. And thank you again, Lieutenant Governor Stratton, for hearing us. You listened and you heard us, and HB 5142 is just the beginning we need to write the course of birth equity across our state, and together, I know we can't be stopped. I woke up today thinking about a lot, but my daughters were one of them. This bill, along with ongoing support for expansive reproductive health policies in Illinois, gives me the hope that in their lifetime, my daughters and their peers can experience birth equity and the legacy of community birth that we all are working so hard towards in this state and across the nation. I also envision them not only being safe in their pregnancy and postpartum, but also their whole lives. It saddens me to think about Sonia Massey and all the other families that are grieving now for senseless killings and preventable childbirth trauma. I will turn it back to our Governor Pritzker for the signing of HB 142, and thank you.
take a few questions from members of the media. Everybody get back to their spots here. Thank you. Happy to take any questions. Mary Ann.
All right, I'm pivoting to off topic, although.
This is an amazing group of people. If you have questions, honestly, this is the best group. Okay.
And there was a lot of enthusiasm, I appreciate it. Can we talk about migrants? And are you prepared if Governor Abbott does send the 25,000 migrants here before the DNC or during it?
As you know, we have a partnership with Cook County and with the city of Chicago. There was an awful lot of planning that went into effect back in the early part of this year, and we're excited about the Democratic National Convention coming. We're also excited to have this partnership in place, as you know, and you can go to the City of Chicago's website to see how many beds are currently occupied, how many beds are available, and also that we have a plan for expanding that if necessary. So far, we have not seen the influx that we might have expected, and one of the reasons for that is because despite the fact that Donald Trump told Republicans to walk away from an immigration bill that would have helped us actually secure the border, that the president has nevertheless put in place a series of agreements with countries throughout Central America and North America, including Mexico, to make sure that we've stemmed the tide of border crossings. And so actually we've seen some of the lowest numbers of border crossings in the last 2 years over the last several months. And I check on that weekly, talk to the White House and others to make sure that that's still the case.
Are your sources been talking back and forth? Is Abbott just a threat, or might that really happen?
Well, of course, we have a governor in Texas who cares nothing for the human beings who have crossed the border, who are in his state. He frankly ships them all across the country, including to Chicago, threatened to do it again when he was at the RNC. But we've not seen any evidence of him increasing the numbers that have been sent to the city of Chicago. Yes? On and off, good.
You mentioned, and Janine as well, that there's more that can be done. Is there talks about any future legislation coming this year? Like, what else does Illinois need?
Well, let's be clear. We need more than just one birth center on the south side of Chicago. Meanwhile, let's actually effectuate what we've got on the plate and make sure that Janine is able to get her work done. But there's more to do, and it isn't just in the city of Chicago, though we could use more here, but also across the rest of the state. So there's work to do. We have to make sure that we have the right partners and also that we're providing the right amount of resources for those centers to open. And that's just one example. You heard a pilot program for providing diapers for moderate and low-income women. And if that pilot program is a successful one, we'll want to make sure and expand that. That's just one example. Yeah.
My hot topic is you met with the Bears CEO a couple of weeks ago.
Yeah.
Any movement there in terms of public financing deal? And also, have you called other mayors or governors in other states about maybe best practices of what they've done that has worked?
Oh, I've done a lot of research on this topic, but let me be clear. There isn't much change. I mean, I made it clear to the Bears leadership that it would be near impossible to get anything done if there was a proposal put on the table by them that could get done. You couldn't actually get it done probably during the veto session and would have to wait until next spring. But in reality, there isn't a proposal on the table right now that would be acceptable to anyone that I know in the legislature.
Governor, can we clarify conversations with the Harris campaign that you were asked about last week? First of all, were you asked to, and did you submit vetting materials? And a follow-up.
This may be the 73rd time that you and your colleagues have asked this question. I'm not going to talk about those conversations, but I've had many conversations and continue to, as I have for weeks and weeks and weeks when Joe Biden was going to be our nominee and now with Kamala Harris as our likely nominee. I talk to the campaign regularly because I want to do everything I can to make sure that Kamala Harris wins and that Donald Trump does not.
Are you denying that you have had any conversation about being a potential VP candidate?
All I'm saying is that I'm going to work my heart out for this ticket.
Would you tell us if you had not been asked?
I'm sorry, would I tell you? I think I've been very transparent about almost everything about being governor and everything that's occurred. And in this case, all I can say is that my guess is over the next 10 or 14 days, we'll all know who the vice presidential nominee is. How did I do? Yeah. Yeah. Oh, wait, I'm sorry. Let me make sure that somebody who hasn't asked a question, Chris.
Yes, Governor. This morning, Governor Whitmer said that she is not part of the vetting, that she's communicated with everyone, including the people of her state, that I'm going to stay governor. Can you say the same?
How many times can we get asked this question? Yeah. Yeah. Again, I'm not going to talk about the conversations that I've had with the campaign about that.
Okay, one quick follow-up. Over the last 72 hours, there's kind of been a changing of the framework of how the Harris campaign is sort of putting in perspective the Trump campaign, using the phrase weird. They're using that word in a way that the Biden team didn't. You've been one of the starkest critics of former President Trump. How do you define this phrase of weird? Do you embrace it? How do you look at that?
Well, I've listened to it. I've actually talked about it yesterday. The truth is there are a lot of very weird, strange things coming out of both the Republican nominee and the vice presidential nominee on the Republican side. I mean, there's this consistent kind of talk about Donald Trump's fear of sharks. I'm not sure why that's relevant to becoming president of the United States. There's the talk about couches and dolphins on the vice presidential candidate's case. And it's just, I don't understand. We should be talking about the issues that are important to working families across the United States. That's what Kamala Harris is talking about. That's what all of us ought to be focused on. Yes.
Governor, do you know if I am Angela McLemore? I am a retired hospital administrator working for State Senator Matty Hunter. And I'd like to know are the tertiary hospitals who see these very high-risk maternal cases, will there be a bill or more monies given to them to render services to these types of cases?
So, as you know, critical access hospitals, safety net hospitals, those I think are the ones that you're referring to, are a real, and those that aren't covered by that are the focus of a lot of work that we need to do about providing midwifery services as well as doulas. And making sure that we're addressing the broad issue of maternal health. It's not been done adequately, even in some of the best hospitals, when we talk about women of color in particular. And so that's why we've got to change the way this system operates. One of the things that we've done is expanded Medicaid to pay for particularly culturally sensitive doulas, culturally sensitive provision of services for women of color. And so there's a lot of work to do. That's why I said that earlier, and I think you heard it consistently. We're not finished. But this is an awfully good beginning to something that's important for us to accomplish.
Governor, can I
Yes.
ask about the CPS bailout? Have you noticed the CTU president's remarks claiming that you are denying funding for Black, brown, or working class immigrant children, and she's somewhat outright lobbying against you as a possible candidate?
Look, I think that they're in the middle of a negotiation, and so I think they're going to say things that they think are going to, will advance their cause. I think I've been clear. I want to fully fund education, public education in the state of Illinois. I have worked hard during my term in office to do that. Billions of dollars more have gone into education, public education for our state. I want to do even more. We're taking every resource that's available to us for education and putting it there. So I know that there are people who would like more. I'm one of them. And so let's go do that, but that is not something that can happen immediately during their negotiation. It is something that I think we should be working on every single year, and I've done that. Again, almost $500 million more has gone into public education every single year since I took office, and I will do everything I can to meet the needs of our students and make sure that we're paying our teachers properly. But criticism at this moment isn't helpful. I think they came to Springfield, they talked to the legislature. We, in fact, did provide a significant amount more money for public schools, and we'll continue to do it every year I'm in office. Yeah, thank you.